salts or something in this water might even further enhance the charge. Are you on? Right.
He's on.
Okay. The use of the PER 2000 underwater, and it's the only unit that I would recommend anyone try this with. And that's because I saw it for myself that it could be done. That is, it enhances the signal clarity and decreases the discomfort from the pulse. Sometimes during acute phases or infectious or otherwise swelled terminal nerve endings can be a bit painful from pulsed fields. But under the water, the comfort level goes up 90%, pain goes down 90%. So I'm convinced if you have the option, hydrotherapeutic pulse electromagnetic fields is the way to go for effectiveness. I'll let you know tomorrow if I wake up. Yes. Now, the damage that you see it dealing with here, this tumor went all the way and caused a walnut-sized tumor on my forearm. So that damage is what is being affected beneficially by PER 2000. But it is obviously still damaged. But I'm alive to do it, because I wouldn't be otherwise. Also, rehabilitation for knee surgery. This is an operation post-op for medial meniscus and anterior and posterior cruciate ligament surgery. So the rehabilitation of the knee on the right has been markedly benefited by PER therapy. And it hurts less and I think it's going to work better underwater. I'm going to try it over my cranial field. In 1985 August, I received a severe life-threatening blow to the head in a chemical factory that I was employed in as research development and engineering. And it hit me just to the right side of the midline. So it's caused my cranial bones to move. I believe it's given me some inherent risk factors of continued degeneration in the parts of my brain subadjacent to that trauma site, as well as creating malposition of the bones of the cranium. So I'm going to attempt to put my head close to this ring underwater and try to discern what feels different about it than in the air. Well, right away what I can tell is that I can take it full strength directly on my scalp, where in the air that's about as close as I can get. Because of the cranial bone problems, malposition, and lack of mobility. And I'm going to go underwater again, put my head against it. My most sensitive part is my face, so I'm going to try that. This is as close as it can get to my face without irritating dental problems. Now, and again, one of the most sensitive problems that I have can now tell that this is a superior way to apply it to the cranial field. I can take the same amount of power, actually greater power, with a greater, I think the signal clarity is greater, but any of the painful or stimulating effects are far less underwater. I would say 50 to 60% decreased, into a range of acceptability where you could do it for a sustained period of time. So I'm going to lay back like this. Feel the spine. Doesn't hurt. And it's touching me. It has my cranial field completely enveloped. And I can definitely feel cranial nerve damage from that impact in its full distribution and stimulation of it with no pain and direct contact. You can put it directly on the scar underwater. And again, the damage from the cancer and the scar tissue formations in between are evident, because normally, I've got nerve damage on both sides. Underwater, again, marked decrease in sensitivity to the pulse and greater proximity to the target without sensitivity issues.